This video is a demonstration of the running percutaneous suture placement using a perpendicular pattern. To place the suture, start at the far end of the wound, starting farther away from yourself so you can suture toward yourself. You're going to want to make sure you start with a full length of suture. In this demonstration, we're using a 4/0 nylon suture fresh from the package. Your initial suture placement is going to be a typical simple interrupted epidermal suture. You do want to make sure that you pull the full length of the suture through such that you have a very short tail on one end. And then you simply tie it off in the typical simple interrupted epidermal fashion. Using a 4/0 nylon suture, that'll be 4 instrument ties. And now here's a key moment. Make sure that you cut only the short end of the suture, because if you don't, you're not going to be able to continue running the suture. You're then going to rearm your suture needle, and you can really begin on either side of the wound. But in order to suture toward yourself, typically you'll start on the right if you're holding the instrument with your right hand. And you're going to place subsequent throws oblique to the margins of the wound. So different from the intuition that you have to throw the needle across the wound in a perpendicular fashion, you actually want to make sure that you're aiming in an oblique fashion down the margins of the wound. Everything else is the same. You're going to point that suture needle down at 90 degrees into the wound. You're going to try to be equidistant on either end of the wound when you enter and exit the tissue planes. But you'll see that in making sure that you purposefully throw your sutures in an oblique fashion, the effect you're going to get is that the exposed suture is going to run perpendicular or horizontal across the wound. In essence, there's really no benefit to doing this over the usual fashion, which ends up in an oblique pattern of suture placement, but it is often an expectation of a patient to see sutures that appear to go horizontally across a wound or perpendicular to a wound. So in order to meet their expectations, it might be kind of fun to try out this technique. You'll continue to run this suture down the entire length of the wound in the same fashion. And if you're really careful about being equidistant with each of your bites, you'll end up with a really nice looking pattern of perpendicularly placed sutures across the wound. Now to finish, you've got a couple different options. Here's the simplest one. As you make your final throw, leave a loop of suture that isn't pulled all the way through, and now you've basically got two ends in which you can perform a typical instrument tie. You'll loop twice around for your first, you'll grab that loop, and each subsequent loop will be just a single time around in order to close the wound with about 4 ties for a 4/0 nylon suture. When you cut this suture, you're going to end up having 3 threads sticking out, but that's okay. It's a little different than what we would normally expect, but it's another way to do it. An alternative to this would be to use something called the Aberdeen knot, which is demonstrated in a separate video. And that's placement of a running percutaneous suture with the perpendicular pattern. To learn more about this and other techniques in basic and advanced wound repair, visit www.lacerationrepair.com.